and certainly a great facility. And thank you, Professor Bates and Nathan. You made me sound great. That's very nice. And thank you, Pam, for asking me as well. And she's going to be bored because she's heard this now a little bit at the time. Some of the same information. I'm going to talk a little bit about Jones Memorial and healthcare, and a little bit about the challenges that we face in healthcare. You're hearing it every day in the news, and especially with the political campaigns, you're probably hearing more about it. I assume that some of you very bright individuals will be leaders if you're not already leaders, and certainly you are in the various roles you play. That someday you will want to be a leader in whatever field that you choose to venture into. Jones Memorial is a small community hospital. We're licensed for 70 beds, but we run about a 40-45% capacity. Inpatient services are dwindling in most hospitals or decreasing, especially community hospitals, and as more and more things are done on an outpatient basis. 20 years ago and 30 years ago when I started in nursing, I'd like to say it was 20 years ago, but kind of be closer to your age. But 30 years ago when I started nursing, when you had your gallbladder out, you were in the hospital with a tube in your nose for 7 days and hardly could walk the first couple of days because you had an incision this long. Now you are in and out in less hours than days used to be. You're in the hospital, you have a little tiny poke, and you're back out of the hospital. And that's like many surgeries. So people aren't in the hospital nearly as long as they used to be, which is great because you get complications when you stay in the hospital too long, or when you're not walking around, you get pneumonias. So hospital and healthcare are changing. Now that really doesn't explain why healthcare costs are spiraling, but we're fortunate that the average age of people is longer and longer, so that's a great thing for us as a nation. But so it's a challenge. It's a challenge in a small hospital when your revenues are going down. We have to increase our wages. Cost of supplies are going up. As I said, we're a 70-bed hospital. Our ER is the gateway to the hospital from the community. Almost all of our admissions to the hospital come through the ER. We have about 13,000 emergency room visits a year. Hopefully that won't be any of you, but if you need our services, we're there. And in a small community like ours, we're 35 miles, 40 minutes, and if it's the middle of the winter, it could be an hour and a half to the nearest hospital. So it's important that we have a good, strong emergency room for our communities. Wellsville is about 6,000, but we consider our catchment area about 50,000 people. So that's a lot of folks that and a lot of those are fringe communities. I mean, here in Houghton, you probably get to Warsaw just as quickly as you can get to Jones. From Andover, you can get to Hornell. So we have of that 50,000 on the fringes, there are other hospitals available. But for a significant number of people, you wouldn't want to have to go, 35, 40 minutes if you've had a seizure, or if your child's got a temp of 106, or somebody's fallen and gotten a bad laceration. So it's important that we have strong community hospitals, whether it's Jones Memorial or Warsaw or Nicholas Noyes and Dansville. We need those community hospitals. We also need very strong tertiary centers. If you need brain surgery or bypass surgery, you're not going to get that at Jones or Noyes. So we need good big hospitals as well. We deliver about 350 babies a year at Jones Memorial, and we have a lovely new birthing unit that has bubble tubs, and it's a wonderful family experience. We try to make it a real family experience. We do not limit sibling visitation nearly as much unless the new sisters and brothers are ill. We don't like them to come to the unit, but grandparents and aunts and uncles, and we try to make it a real family experience, and so we have a lovely new unit. We have about 400 part-time and full-time employees. We're very happy that we're not the largest employer anymore. We're about 4th on the list in Allegheny County, which is good for us because that means there are more people out there potentially using our services, and we've been able to cut back. But the economic impact of Jones Memorial is $62 million annually for our community. When you consider the taxes our employees pay, and the services that we utilize from around the area. We try and utilize local contractors when possible and use local vendors. About 45% of our business at Jones Memorial is government-sponsored, in other words, Medicare, Medicaid. That's a very high percentage, and that's that's a struggle for us because the government doesn't always pay real well. And then on top of that, we have a significant amount of underinsured population or uninsured. A lot of folks in our community, even if they're working, are working part-time jobs and small employers. We have a lot of cottage industries in the area, and small employers can't afford costly health insurance. For a full-time employee at Jones Memorial that has our health insurance for family coverage, it's about a $14,000 a year benefit. The employees pay 25% of that. So can you imagine your hard work? Can you imagine if you're working in the dietary department, you're working in environmental services, your pay, if you've got to carry family coverage, even if you're only paying 25% of that, that's a lot of your paycheck. Hardly makes it seem worth it, I'm sure. They've got to pay for babysitters and other costs as well. So healthcare is extremely expensive, and it's a huge benefit. But when you don't have it, or you're working part-time, so you don't qualify for some of the programs, and you don't have health coverage, it's expensive for the individual, but it's expensive for the providers because we're not reimbursed, and very often we're providing that as charity care. And that's part of our mission. We wouldn't be there doing what we're doing if we didn't realize that some of the care is not going to be compensated. So the state of healthcare. You're hearing a lot about healthcare in the political campaigns. You're reading a lot about healthcare. Certainly President Obama finally got past his healthcare Reform Act. What that will do, it will significantly increase the number of people that are covered by various insurance programs and modify some of the insurance programs, how they can cover and who they can cover, eliminate some of the pre-existing condition exclusions. Could you imagine being tunneled into a job that you have to keep, you can't move because you had a pre-existing condition, and your next employer, the insurance might be able to say, well, we aren't going to cover that because you had that before you came here. So those are very positive things. But as in America, as in a society, are we all willing, and it's mostly you in this room, you as young people are going to have to bear the brunt of some of the decisions that are being made now, and your financial health and your wealth will be affected by some of these decisions, certainly, that we're making now. Are you willing to step up and say either pay more taxes, or that to cover some of the healthcare reform agenda, or will you concede to the choices that we may have to make? I'm sure that you may have heard some of the stories and coverage of like Canada's healthcare program. That's really a national healthcare program and a government-sponsored. Everyone gets the same healthcare, whether you're the prime minister or whether you're, no matter what your job is or what your role is, you get the same healthcare. And if you need your gallbladder out, you might have to wait 3 or 4 months. If you need a hip replacement because you're having pain, you might not get it next week. You might have to wait 6 weeks. So there's not as much choice there, and there's some rationing. In Sweden, for instance, I know one of my friends in Wellsville has a friend that lives in Sweden, and she's 85 years old, and she needs a pacemaker. They're saying at 85 they're not going to cover the pacemaker. They're giving medications. Now, how do we feel about that as a society? I don't know the right answer. I mean, I'm not sure there is a right answer, but are those choices we may have to make as we move into the future? And as I said, it's your generation who's really going to feel the brunt of that, and maybe have to be involved in making some of those decisions. They're not easy decisions. We like immediate gratification. We like total freedom of choice. And will we be able to afford that? But is it right that in one of the most industrialized, one of the greatest nations in the world, that healthcare is a privilege? Should it not be an expectation that our citizens are afforded basic health care? So to some of us that have a lot, give up some so that all can have basic health care. I think that's some decisions we'll have to make in the future. Some of our challenges specifically at Jones Memorial, and I think at many small hospitals, are workforce issues. One of the issues with the healthcare reform is we've learned from the Massachusetts experience that instituted coverage for all. They instituted coverage for all, but they didn't have doctors for all. They didn't have enough primary care physicians in their communities to take care of everyone who now all of a sudden had coverage and were flocking to the doctor to get care. So there were some challenges with having enough providers. A lot of young people, and I know you have a pre-med program or a kind of a prep program for med school. We keep in touch with local students that are in medical school or in difficult to recruit curriculum. So if anybody wants to give me your name, I'll put you on our list. But and one of the things that we find is we start communicating with them when they go to undergrad and when they are in med school, and many of them are going to be internist primary care. Well, and then they get there, and then they start to look at reimbursement for their services from a primary care standpoint, and the hours they might have to work, and all of a sudden now they're specializing and subspecializing, and they're no longer going into primary care. And as we move forward, we are going to have a shortage of primary care providers. At Jones, we employ a lot of our physicians. We'd rather not, but to get them to come to the area, we employ them. We have a complement. About half of our providers are physician extenders, nurse practitioners, and physician's assistants. And they function very well in the office setting and give wonderful care to our patients. So, I mean, that's a direction we've chosen to go in, somewhat out of necessity, but also because we think that they provide very adequate care to our patients. So we are going to have a shortage of primary care doctors, and it's something we're going to have to face as a nation. So even if we have coverage, are we going to have enough people to take care of them? Nursing, certainly you've all heard about the nursing shortage. We're very fortunate in our area. We have 2 schools of nursing on either side of us. We have Alfred State and JCC. So for a small hospital, we're in a lot better position for nurses than many facilities. Same way with medical imaging technologists. We have St. James School of Radiology in Hornell, so we have more radiology students and more graduates than we really can employ. Where we have the problems are ultrasound technicians, lab technicians, those areas where we don't have a school within 2 or 3 hours of us. So certainly there are challenges, and challenges all over the country. So healthcare is a great avenue to go from a career standpoint. You really have a lot of choices. Reimbursement is a significant issue. I have some statistics that are pretty astounding. Medicaid reimbursement increased 1.02%, 1%, and negative 0.3% from 2007 to 2009. Jones Memorial's health insurance increases for those very same years, the health insurance we buy for our employees, and it's not a platinum package, it's bronze at best. The increases were 17, 29, and 17%. The premium cost for every employee went up that much in those years. So the costs that we're having to pay are definitely not are way in excess of the reimbursement increases we have. And the volumes are falling. So I know you're all business majors, but you add all of those up, and certainly it's not a great equation for us. So that's definitely a challenge. The economy in the area, I don't know how many of you are local or how many of you know, but Allegheny County for a couple of years now has been the poorest county in New York State. Not a statistics we never necessarily embrace and are proud of, but one we have to deal with. We know we have a poor county. We have a lot of haves and have-nots. Our average income is among the lowest in the state, and so that's a challenge. There are definitely higher rates of certain illnesses among the poor, and we have to deal with that. So definitely a challenge. The poor economy, as even people who have the means are making different choices. when they have to pay deductibles of $30 and $50 for an outpatient visit or an ER visit.